Okay, in this video, we will be discussing about Lewy body disease. See, Lewy body disease is a wide spectrum of diseases in which on one end there is uh, Parkinson disease with dementia, PDD means Parkinson-like features preceding the dementia by almost 10 years or so. And second end of spectrum is dementia with Lewy bodies. Basically, we are discussing about the dementia. So Lewy body disease is a cause of dementia. It is second most common cause of dementia after Alzheimer's disease. So it can present as either Parkinson disease with dementia or dementia with Lewy bodies. As we have already discussed, Parkinson disease with dementia means there is development of dementia almost 10 years after the development of Parkinson disease. Means Parkinson's disease precedes that of dementia. But in dementia with Lewy bodies, there is development of dementia before or along with, means simultaneously along with Parkinson's disease. So these are the two ends of the spectrum. In one end, there is dementia before Parkinson's, and in second end, there is Parkinson's before dementia. Now, what is the neuropathology? See, there is intracytoplasmic inclusion bodies, which are known as Lewy bodies. There is development of these Lewy bodies, that is the pathology. These are pass positive and ubiquitin positive. These Lewy bodies are pass positive and ubiquitin positive. The material is basically proteinaceous kind of material. So it is, the cause is unknown. The exact cause, the exact pathology, the pathways are basically unknown. But what we see under the microscope is intracytoplasmic pass positive and ubiquitin positive uh, inclusion bodies, which are known as Lewy bodies. And these, if we go into detail, these Lewy bodies, they exhibit a prion like property, means there is spread of this Lewy bodies from one neuron to the other. So this is a very unique kind of pathology that is basically beyond the scope of this video lecture. But just for the sake of understanding, Lewy bodies exhibit prion like properties. The exact mechanism is unknown, but what we see in the microscope is pass positive and ubiquitin positive Lewy bodies. Now the neurotransmitters involved, means there is destruction of neurons in certain areas of the brain, for example the forebrain, for example the basal ganglia. That is why there is dementia, that is why there is Parkinson's disease like features. So there is two neurotransmitters which are mainly involved. One is the acetylcholine. There is cholinergic deficit which results in decreased attention, and secondly there is adrenergic deficit which results in decreased arousal, right? As far as clinical features are concerned, there are visual hallucinations, very very important. The question when it comes, it will ask what are the, I mean, how do you differentiate between Parkinson disease dementia or dementia with Lewy bodies from other dementias like Alzheimer's disease, like frontotemporal dementia, vascular dementia? The main thing, the main history, the main finding that we get is visual hallucinations. Although REM behavior disorder, REM sleep behavior disorder, Parkinsonism, fluctuation in attention, delusion, and delirium are also important, but mainly what we see is visual hallucinations. So this is the differentiating point from other kind of dementias, right? To to emphasize it more, let me tell you once again. Clinical features are visual hallucinations, REM behavior disorder, means REM behavior sleep disorder, Parkinsonism like features, fluctuation of attention. There can be delusions, delusion of infidelity, delusion of theft, and there can be delirium. What are the investigations? First is the MRI brain. There is amygdala atrophy. Basically, we do MRI and other imaging to rule out other causes of CNS disorders. Second is the polysomnography. there is REM behavior disorder on polysomnography. Then in CSF, there is alpha synuclein levels which are decreased. Alpha synuclein levels are decreased. The method by which we detect this is CSF RT quick. Fourth investigation is MIBG scintigraphy. We see myocardial scintigraphy. We do myocardial scintigraphy because there is postganglionic denervation. Postganglionic denervation of cardiac sympathetic cardiac sympathetic nerves. Fifth is the PET scan. We see cingulate island sign. What do we mean by cingulate island sign? Is the cingulate lobe, the cingulate gyrus is preserved. There can be atrophy of the surrounding areas, but cingulate lobe is preserved. What is the treatment? See, mainly we give acetylcholinesterase inhibitors, that is rivastigmine and donepezil. We give clozapine also because there are psychiatric complaints. We give pimavanserin to reduce the hallucinations, right? We give melatonin for REM sleep behavior disorder. We give SSRI for accompanying features like depression. We prefer escitalopram. And then we do physiotherapy, which is unimportant because patients are, many of the times they are bedridden. They go bedridden, they lack self-care. So physiotherapy and all those supportive care is very, very important. So that is all about Lewy body disease. To recap once again, it is second most common cause of dementia after Alzheimer's disease. It can present as Parkinson's disease dementia or dementia with Lewy bodies. Neuropathology is intracytoplasmic deposition of Lewy bodies, which are POS positive and ubiquitin positive. Neurotransmitters, cholinergic deficit, adrenergic deficit. Clinical features, visual hallucinations. Investigations, MRI polysomnography, CSF RT quick to see alpha synuclein levels, MIBG scintigraphy, postganglionic denervation, PET scan will show cingulate island sign. Treatment is rivastigmine donepezil. It is the main drug that we rely upon for the treatment of Parkinson disease, dementia, Lewy body dementia. Clozapine, pimavanserin, melatonin, SSRIs, and physiotherapy and supportive care. Right. So that is all about dementia with Lewy bodies. Thank you. Thank you for your patient listening.